Thanks very much and good morning, everybody. I'd like to welcome you all to this multi-stakeholder dialogue for the Latin America and Caribbean region entitled Inspiring Change, Putting People First, Shaping Health Systems for People Living with NCDs in the COVID-19 Era. My name is Katie Dane and I'm the CEO of the NCD Alliance. And we're delighted to have with us today a panel of distinguished speakers and members of the NCD community, including people living with NCDs and other relevant stakeholders. Today's dialogue is hosted by the NCD Alliance and with the support of the Leona M and Harry B Helmsley Charitable Trust. And I'd really like to thank the Helmsley Charitable Trust for their support and for their collaboration in making this regional dialogue happen. For those of you who are not familiar with us, the NCD Alliance is a global civil society network bringing together a unique community of 300 members in more than 80 countries, dedicated to supporting a world free from preventable suffering, disability and death caused by NCDs. And regionally in Latin America and the Caribbean, we're really pleased to have 14 members and 9 national and regional NCD alliances who are all extremely active in leading advocacy, raising awareness and providing essential support to people living with NCDs across the continent. We also, as an organisation, work very closely with governments, with UN agencies, WHO regional offices, private sector and foundations to translate knowledge and global commitments on NCDs into action and help ensure that good practice in evidence-based NCD policy implementation is really shared internationally, regionally, and nationally at forums just like this. Today's dialogue is particularly important and timely. According to PAHO, 80% of deaths in Latin America and the Caribbean are caused by non-communicable diseases. And the region has become one of the epicenters of the COVID-19 pandemic. Services for the prevention and treatment of NCDs as a result have been critically affected since the onset of the pandemic in the region. According to current data from PAHO, each year NCDs are responsible for 5.5 million deaths in the region. And many of these are premature, happening at a young age. And this is obviously without considering the significant impact of COVID, which is very much the focus of today's virtual dialogue. The NCD community over the last year or so has experienced COVID as a syndemic, with people living with NCDs severely and disproportionately impacted in several ways. In the Latin America and Caribbean region, cardiovascular disease accounts for most NCD deaths, followed by diabetes, cancers, and respiratory diseases. And these are the comorbidities most affected with COVID-19. And COVID-19's effect has been felt in health systems and economies across the region, creating really widespread disruptions to access to essential medicines and technologies, to healthy foods, as well as disrupted health services such as screening, treatment, and palliative care. And these represent a significant challenge to sustainable development, to achieving progress towards the universal health coverage targets, and of course, recovery from the pandemic itself. In addition, we've seen over the last 14 or 15 months, the pandemic imposing serious impacts on mental health as well, such as extreme anxiety on people living with NCDs, for people who can isolate and more so for those who cannot afford to. Overall, it's very clear that COVID has exposed the damage that neglecting NCDs and cutting public spending on health, on prevention, and on essential public health services has done over many years in many countries. And to better protect people living with NCDs, there's really an urgent need to revisit and really reinvigorate the need for multi-stakeholder partnerships for NCDs. The response to NCDs in this region, as in all regions, really does need to be focused on the multi-sectoral approach and ensure that people living with NCDs are very much at the centre of those approaches and those partnerships. And so with that in mind, between May and June of this year, the NCD Alliance is hosting a whole series of regional multi-stakeholder dialogues in 5 WHO regions. Today's meeting is the second in the series, closely off the back of the Africa meeting that we held a few weeks ago, and will be followed by another in Southeast Asia and the Western Pacific on June the 16th, and then the Eastern Mediterranean on June the 22nd. And in terms of what we're really trying to achieve through this regional dialogue are a few different things. Firstly, to take stock of progress achieved on NCDs and the particular challenges faced at the regional level within the current COVID-19 context. Secondly, to discuss the value and importance of adopting a people-centered approach to NCDs and explore the different roles that different stakeholders can play in this regard. And thirdly, facilitate the development of a common vision and a shared purpose across sectors and stakeholders, acknowledging their different drivers and potential enablers to embed meaningful involvement of people living with NCDs in their organisational practices. Over the next couple of hours, we'll hear from panelists representing different stakeholder groups, including governments, multilaterals, regional and national civil society leaders, relevant private sector and foundations, and of course, people living with NCDs. Our discussions through the whole series of the regional dialogues will feed into a broad consultative process that we're leading in order to develop a global charter on meaningful involvement of people living with NCDs that really will seek to provide a shared understanding of meaningful involvement, its importance, the key principles and strategies behind such an approach, as well as what different stakeholders can do to achieve these goals. The Global Charter on Meaningful Involvement of People Living with NCDs will be launched at our Global Week for Action in September of this year in 2021. And we'll be really encouraging all interested stakeholders to endorse this Global Charter and to really embed the principles within organisational practices and processes. With that all being said, I will now hand over to our fantastic moderator for today's event, Beatrice Champagne. Beatrice is the coordinator of the Healthy Latin America Coalition, obviously the regional alliance for Latin America that we've worked with for many years, and is obviously an extremely well-respected leader and advocate in the region. So you're very much in safe hands for the next couple of hours. Let me hand over to you, Beatrice, now. Thank you.
Buenos días a todos y todas.
Hello to everyone. It's a pleasure to have been invited to be a moderator at this event. This event is a dialogue, a regional dialogue on a multi-stakeholder level for America, Latin America, and the Caribbean. And I'd like to repeat something Katie said, which is we'd like to inspire a change and make people the forefront of this by supporting these changes in this moment that's so difficult, which is the pandemic of COVID that we're going through at the moment. These dialogues will help us to rebuild our societies and our healthcare systems and in illness prevention in a more fair way and taking into consideration the meaningful participation of people who live with these diseases. This process that we're going to go through in the next few hours is going to contribute to the creation of a global charter, which Katie mentioned, which we hope to be able to launch in September at the Global Launch Week. I'd also like to mention the goals in this event. We want to take stock of our progress in terms of NCDs and also look at the challenges that we're facing in our area. We want to talk about the value of taking on approaches which are focused on people affected by non-communicable diseases and explore some different areas of our society so that we can highlight successful models and programs that we've put into place in this area. And the last thing we want to highlight is to be able to facilitate the development of a shared goal. These are our goals, and the agenda today will be set out in a few sections. So we've got a few people that are going to try and help us to understand what our goals are. So we're going to have a panel with 5 people, and each one of those 5 people is going to speak about what their perspective is in terms of how we can put people at the forefront in our fight here. We're going to present some questions to this panel, and then we'll have a second discussion in which we're going to talk about some solutions affecting different areas. And then again, a chat. This dialogue will allow us to ask questions to these panelists, and they'll be able to give us their answers. The chat dialogue is incredibly special because normally we'd be able to have a face-to-face chat, but we're going to try to respond to these questions and create a dialogue with our audience today. I'm going to do the first presentation here. We're going to listen to the words of the Deputy Gabriel Cuevas Barron, who is the president of the steering community for universal health coverage and also part of the Mexican Congress. She was the youngest federal representative. She was just 15 when she started her work in politics, and she's had 3 turns in her position in the Mexican Assembly. So without further ado, here is Deputy Gabriela Cuevas. Thank you for being here. It's a pleasure, and it's lovely to be here with the NCD Alliance and to be able to represent the UHC Steering Committee for 2030. And to open this dialogue about NCDs in this region. The COVID-19 pandemic has given us quite a few painful lessons, and it's how inequality has meant that this right to healthcare has been without of reach for so many people, and especially in Latin America and the Caribbean. In terms of health, we've based these data on tragic research and the people that live in terribly vulnerable situations. And we've got to say it clearly. All these things ended up in NCDs, as we saw at the end of 2019. NCDs represented the highest cause of death in Latin America and the Caribbean. So they were already a huge area here. So this pandemic has meant that there's been an interruption in the healthcare and has left these people unprotected, even when they are at the most vulnerable in this pandemic. We need to remember that because they don't have healthcare in this region, some hospitals had to leave patients who suffer from other diseases to one side. So not just people who are being affected by the COVID-19 crisis, but people that were affected by other diseases couldn't get healthcare. So from a perspective of UHC 2030, we consider that we have to put people in the spotlight. They have to be at the center. And this means that we need to make our progress much more stronger in terms of UHC universal health coverage. And we need to do this through government programs and by inputting healthcare systems for everyone. We are a platform that has got a huge range of people who are part of us, but we've all got the same goal, and that's to get to universal health coverage. So we have people from this private sector, government, civil society, all these areas. And the only way we can really make healthcare available to everyone in all regions is by working together. So with this, what we are doing is we're working as a base to make sure the commitments that we've got from the political side in terms of the UN, that they are committed to helping us reach these goals with an agreement we reached 2 years ago. With universal health cover, we can help people in all areas of health. So getting this coverage for everyone and immobilizing all the countries to support this, it means we make more resources available for all of us. And this means we can help people by using these resources to help people who live with NCDs. We can't leave aside in this region the role that corruption plays, and it's affected massively how we've carried out these administration and healthcare systems. So we have this problem here in public health systems that we need to address. So there also aren't enough healthcare workers, and there's also a lack of certain medicines here, and there's certain idea of non-official payments going on, and this all affects people on many levels. And inequality just gets more and more severe whilst you separate the healthcare system and what we're working towards here. This is why we need reinitiation mechanisms, and these groups should be able to show where it affects them on all levels in terms of sustainable development. And we need to look at premature deaths for preventable diseases. We recognize that citizen participation is incredibly important, and also parliamentary support. And of course, the work that we can all do together in these social sectors, and this is how we're going to be able to guarantee equal and functional measures that can benefit us all. So in private sectors and in other areas, we can all work together on a social and political level. So we've got different stages. So we have to generate awareness, give information, and why is this social agenda important? Why is this healthcare system important? So create awareness can make a huge difference for millions and millions of people. But we also have the other side, which is reinitiating accounts and evaluation. And this is when we need local governments and the private sector to work as a set. And of course, whilst implementing this, it's incredibly important to be able to count on governments that are committed to making our healthcare system stronger. And let's learn from what we've experienced in this COVID pandemic and what we've been able to prepare when we were looking at facing emergencies to make our system much stronger. It's also incredibly important that we work together on a community response. When we look at UHC 2030, we look at which systems are more effective when we're going into these areas and when we're looking at local regions. And the most effective ones are the ones that work with timely and necessary information. And also when there's a community movement and when people are committed to, there's a commitment from the healthcare system side as well. And this benefits everyone. Money shouldn't decide who lives and who dies. It shouldn't decide who gets healthcare and who does not. But when we've had some official dates, it's shown us that there isn't enough equality in these systems. Public spending is underneath by 3% and what is recommended on a state level. And so we're not even getting towards the 30% of what we consider is minimum in public funds for health. So if we look at currently what public spending is on per person, the data is terrible if we look at the context of the pandemic that we're in at the moment. In 2020, people living in poverty were above 290 million people, a huge increase on the previous year. And this is obviously affected by the pandemic, but this is most affected those who have already been excluded, which are normally the women and the children who find it even more difficult to access this healthcare now. And there's a disproportionate level in which they're affected by unemployment and vulnerability. And then also people that live with non-communicable diseases who haven't been able to access the healthcare that they require during this period. From this context, what we need to do is increase public funding so that we can make wider public health services and make it more equal. And so that it's also easier to access medicines and products that need this, especially for those people that live with NCDs, and that any lack of access to medication can cause a huge danger to their health. So we need to look at eliminating all the charges that are associated with these medicines sometimes, and also access different systems that help them access this information in a digital way, but get them access to a digital platform. So we also need to look at eliminating charges in other areas, because one of the problems with healthcare systems in Latin America is that it's a condition system, and we work on schemes, and there's also issues that the doctors have to deal with when they're working within their system and what they earn from these areas. What happens in this situation is then certain elements of this system aren't compatible with universal health coverage because they leave certain people excluded from this sector. So to conclude, the right to healthcare depends completely on whether the politicians are willing to support this and whether we are willing to research this in other areas. We need much more inclusive programs, much more people-centered programs in all regions so that everyone has access. On the 14th of December, we're going to have the Day of Universal Health Coverage, and we're going to focus on investing in healthcare systems for everyone, and that we don't leave anyone's health out of this protective system, and that we need to put the people in the center of our objectives, and that only by working together can we reach these healthcare systems that we require. If we don't do this, by 2030, 5 billion people could not have access to a decent healthcare coverage system. Thank you so much for this dialogue. We are here to help, and we are here to collaborate. Deputy Cuevas, that was an incredible introduction to this event. I would like to highlight the importance to making advances in universal health coverage. And another point I'd like to highlight is the role that corruption plays in deepening the divide in people, and that we need accountability when it comes to this. And access to healthcare is something that requires the involvement of different sectors of our society. So many thank you, Deputy Cuevas. Now I would like to present our next speaker, and he is Bruno Hellman, who is a member, a steering committee member, which is Our View, Our Voice, which is running for diabetes and Association for Diabetes in Brazil. And he's going to give us a perspective from a personal side of people that live with these diseases.
Thank you very much, Beatrice and NCD Alliance for once again inviting me to take the part in such important initiative, which is to put people first, to put people living with chronic conditions in the center of the debate. I must admit that's quite hard to contribute or to participate after Ms. Gabriela participation, but I'll try to bring another perspective, which is the person from living with NCDs. Before I start, I would like to disclose that I have a huge conflict of interest, and this is the 30 million people dying each year by NCDs, and the 460 million people affected by diabetes worldwide. So the place I'm speaking on the place of a person who have been living with type 1 diabetes for over 8 years and with mental health conditions for over 4. We have seen on the last years a lot of progress, especially led by NCD Alliance and followed by WHO. There were various initiatives, to mention a few. We had the informal consultation on people living with NCDs last December. And then we have this year, the informal consultations on people living with diabetes, plus the launch of the NCD labs, which WHO managed to not only involve, but also co-create the concept of this new initiative in 3 main frameworks, which are gender equality, meaningful involvement of people living with NCDs, and also youth health. Also, moving forward on the launch of the Global Diabetes Summit, for the first time, we have seen WHO working side to side and really not only walking the talk, but also walking the walk. So we have seen them walking by our side, holding hands. So I don't want to sound too much optimistic, but I say that the global framework looks really promising. And WHO just confirmed that they will be launching soon the framework of meaningful engagement of people living with NCDs, and also NCD Alliance has been working on their global framework. So it's promising, and I must say that I'm really excited and ready to take part on this and to guarantee that as many people as possible from different perspectives, from different backgrounds, from different cultures are involved throughout this process. Promoting meaningful engagement or meaningful involvement of people living with NCDs is not consulting them whenever it's convenient for government, for like international boards or any other organization. Promoting meaningful engagement or involvement of people living with NCDs, it's an ongoing process on which, from conceptualizing until evaluating, we involve everyone. So to finalize, I would like to highlight the importance of this global movement. And now it's up to us, health advocates, people living with NCDs, to bring this to the local and regional level. So I invite especially WHO and PAHO and other regional office to join this conversation and promote and guarantee that people living with NCDs are in the center and are the main voice on this movement from now on. Thank you very much, Beatrice. Thank you very much, NCD Alliance. And I hope that soon we see the difference being applied not only on fancy papers, but also into practice. Thank you very much.
Excellent, Bruno. Perdón, te estoy cambiando de idioma, pero muchas gracias, Bruno.
Excellent, Bruno. Thank you very much. Particularly, I like the optimism that you are expressing, because you need to be optimistic. Things are changing. That's true through this terrible experience of the pandemic, but there is a new conscience, and that's absolutely true. Thank you very much. Very important what you said. Now we're going to move on to the discussion panel number 1. And we're going to, well, it is going to give some shape to the future of the NCDs. How do we put people at the center? And this is a regional perspective involving people, putting people first, which will delve on the importance of community-driven approaches. And the first panelist is going to be Dr. Anselm Hennis, who is the director of the Department of Non-Communicable Diseases and Health of the non-communicable and mental health, non-communicable diseases and mental health of department in the PAHO, in the Pan American Health Organization. And it is an important effort carried out from this institution to develop and carry out responses to the pandemic and the non-communicable diseases in this case. Thank you. You have the floor, Dr. Hennis.
Yes, morning so much. Morning, Dr. Beatrice. Good to see you again, and good morning, colleagues and participants. Now, the coronavirus pandemic has placed substantial burdens on many healthcare systems worldwide, as they have struggled to treat both COVID patients and maintain essential primary care services, particularly in low-resource settings. But even before this pandemic, large gaps existed in access to and quality of NCD services in the region of the Americas. And this has been worsened by the COVID-19 situation and the resulting socioeconomic impact. We know much about the role of NCDs and risk factors such as tobacco smoking and other chronic conditions in terms of severe COVID disease and increased likelihood of death, in addition to the role of older age. Now, what are some of the health impacts? Now, 250 million people in the Americas live with a chronic condition. Now, through Pan American Health Organization, World Health Organization, we carried out a survey on the impact of the pandemic on NCD services in the Americas, firstly in May 2020, and then we did a second similar survey in April of 2021. And we learned that many Ministry of Health staff have been designated to work in NCD services, who have worked in NCD services have been redirected to work in a COVID response, which reduces the availability of personnel to manage NCDs. Now, in terms of the service disruptions, in the first round last year, May, about 43% of countries reported disruptions in hypertension care, and it's similar this year at 41%. A year ago, diabetes service disruptions affected 50% of countries, 45% of countries this year. This is in the Americas. Acute dental services disruptions impacted 43% of countries, 50% of countries a year later this year. Cancer services were disrupted in about 25% of countries a year ago. Now it's 32%, so it's worsened a bit. And asthma services were disrupted 25% a year ago, and now it's 40%. That's worsened considerably. So we're seeing basically a consistent persistence of disruptions. But there's been preservation of acute coronary care, 79% last year, and 81% of services is still intact. So therefore, the impact of the pandemic has been quite significant in terms of service delivery. Now, the main reasons cited for these service disruptions for NCD include the cancellation of elective care services, clinical staff being reallocated to the COVID response, and patients just not showing up. And there are many reasons for that. Fear, lack of transportation, lockdown measures to prevent spread of the pandemic, among others. And the main strategies to tackle service disruptions have been to triage patients and prioritize them for access to care depending on severity of conditions, the use of telemedicine to replace in-person consultations, and novel dispensing means for NCD medications. Similarly, there have been disruptions to the delivery of mental health services, which have been quite significant. Now, what are some of the implications of these service disruptions? Likely increased acute complications, as well as later mortality from chronic conditions. While we're not aware yet of the full extent of what the implications will be, these service disruptions have led to decreases and delays in identifying new cases of cancer in a timely manner and delivering timely treatment. We don't yet know, but the predictions are that, for example, in the UK, we're going to see an increased mortality by about 11 to 14% in the next 4 years or so for some of the common cancers, and persistent morbidity for the years to come. Now, the other question really is, what is the relevance really of people-centered models of care in the context of NCDs and health equity and lessons we have learned from the pandemic? Well, really, just for a definition, integrated people-centered health services means putting people and communities, not the diseases, at the center of health systems, and empowering people to take charge of their own health rather than being passive recipients of services. Now, this model of people-centered health services actively adopts and incorporates the perspectives of individuals, families, and their communities. And in this context, they're both participants and beneficiaries of health systems that respond to their needs and preferences in holistic and humane ways. A key issue is that person-centered care requires that people have the education and support they need to make decisions and participate in their own care. It means that they must have the skills of health literacy, and it is organized around the health needs and expectations of people rather than the diseases. And there's clear evidence that health systems oriented around the needs of people and communities are more effective, they cost less, they improve health literacy and patient engagement, and they're better prepared to respond to health crises. And such health services are managed and they deliver the continuum of healthcare through promotion, disease prevention, diagnosis, treatment, disease management, rehabilitation, palliative care services at the different levels and sites of care within the health system according to the needs of those it serves. So in other words, if you need secondary, tertiary care, you have access to these systems and you can then interdigitate with the primary healthcare level. So what is needed to have this type of service, patient-centered care? It means expanding access to health services. It means strengthening stewardship and governance, increasing and improving financing, and strengthening intersectoral coordination. It means eliminating barriers for care. And one of the key components is the first level of care for NCDs, and they must be more responsive through investment and through training. And there must be a transformation such that NCDs must be incorporated as a key pillar of primary health care. And I will also share with you that we also need to look at the whole issue of addressing structural barriers. And people who are most affected are those who live in vulnerable conditions, migrant populations, the poor indigenous populations. And we actually know that in Latin America, there's been a disproportionate burden of COVID. I mean, young persons in informal occupations who could not sustain themselves during the lockdown measures and actually went to work and spread COVID and suffered and died excessively from COVID. It also needs, so we must address the social determinants of health and also have intersectoral interventions in NCD plans. There must be increased physical space for health. And we must also institutionalize mechanisms for involving people living with NCDs in the development of these plans, programs, policies, and systems. So in summary, COVID-19 presents an opportunity to strengthen health systems and prioritize NCD services towards universal health. Strategic investments will be required for a transformed health system to respond to people's needs for NCDs. We must integrate NCDs and strengthen primary healthcare, including building service capacity. We must use the innovations that we have learned, for example, with digital health, and we must also strengthen surveillance for NCDs to build more resilient health systems as we recover from the COVID pandemic. Thank you so much.
Como siempre, excelente, Dr. Hennis.
As always, very, very good. Excellent, Dr. Hennis, and very useful presentation. showing through these surveys by the OPS the enormous impact of the COVID-19 pandemic, and as well as the problems that have derived from the lack of staff, the fact of that patients were not able to see their first needs attended and taken care of. And very interesting what you mentioned about the transformation required and the structural barriers existing in our region. I think that this is a very, very much necessary transformation, what is needed. Anyway, we are going to now continue with the perspective of Health Ministry. Dr. Alejandra Acuña, who is the Vice Minister of the Health Ministry of Costa Rica, is going to speak. She has been working in the Health Ministry for over 40 years, and she uses an approach from her studies in nursing, and always putting an emphasis on women. It is going to be very interesting to listen to this perspective, because we would like to know more about the importance of investing in NCDs and how our governments and the health ministries consider them. So please go ahead, Dr. Acuña. Thank you very much for being with us. No, thank you very much to you for your invitation. It is a pleasure to share this space with you. We've had a very important preamble of how governments should act. I'm going to explain what Costa Rica is doing. Costa Rica has a unique health system with a health model which is putting people first, with a lot of challenges, of course, but it is a model that has included the social determinants of health and addressing or always focusing on universal coverage, which has enabled us to generate a series of rules, protocols, and norms during the pandemic, so as to minimize the risk of the people that are at higher risk. Precisely, the NCD people, or the people with NCDs, were the ones who had to be put first and take care of. And there were a lot of messages focusing these groups of population, messages that were specific for each of these groups, with a first level of intervention during the COVID pandemic for NCD patients, looking for the involvement of social entities as well. I mean, our participation is not 100%. There's still some room for improvement, but we have been advancing towards what we call the Costa Rican model, the Costa Rica trabaja y se cuida model. So Costa Rica takes care of itself model, more or less. That would be the translation. So the health ministry was carrying out a management, including community management, and including also health institutions and social institutions, assessing specific plans according to every type of disease. And these assessments were carried out also with a review of how many people were in the community bearing risk factors, namely elderly people, NCD patients, and of course mental health patients. Every sector or every region in Costa Rica made a different plan, but with a general coordination. The doctor, the OPS doctor, was mentioning also that many of the surgeries, of the visits to the doctors were suspended, of course, but the drugs were taken home to the patients, and these allowed us to take the treatment to many of the homes. There was a community participation project created for health focusing on people first, or putting people first. And this project was a very important one because it has enabled us to review the necessary elements during all this, all throughout this multi-sectoral approach, and see how we could have an impact, a positive impact on other regions of the country. And well, we reviewed with development associations and NGOs from the municipal, with a municipal approach, how to look for mechanisms. We have not finished this battle. We're in fact right now struggling for this, but we have indeed achieved the involvement of many communities, and we have kept this system open, which has enabled us to maintain the processes. We have established alliances between the governmental sector, private sector, and social and civil society, sorry. And of course, we need to reapproach the strategy in the case of NCDs, and this together with the civil society organizations. And therefore, I consider that from the government, we can perfectly well establish active participation channels, local participation channels, involving people and putting them at the center of care. We have the experience in Costa Rica as well with a pilot project, and we have achieved large applicability. Thank you very much. Thank you very much, Vice Minister, for joining this meeting and very important presentation, particularly in all related to the opening of the Ministry of Health to the different participation channels. Thank you very much. Now we're going to continue with Mr. Jaime Barba, who is an activist of our vision, our voice from Mexico Saludable. And he's going to share his experience with us about NCDs, or non-communicable diseases. Thank you very much, Beatriz. I would like us to imagine a bicycle manufacturing plant where they are doing everything possible to build the best bicycle with the best materials, with the most advanced technique, but without thinking of the bicycle rider. I mean, do you think they can win a contest? I mean, to make a good bicycle, riders or cyclists have to be considered first. People living with non-communicable diseases, we are riding bicycles, and in many cases that bicycle has not been manufactured thinking of us. Sometimes the bicycle is very heavy or too large or too small. For us as patients, the distance to cover is always very long and always uphill. An effective health system should put people at first, at the center, listen to our needs, and the final end or the final purpose of every health system should be human beings. I live with COPD, which is a disease due to my tobacco addiction, or addiction to tobacco, to smoking. I've learned about a lot of people living with these diseases, diabetes, or other non-communicable diseases that are living always linked to the dialysis. Other friends lived with cancer. COVID has changed the world. We need governments to change. They should stop playing short with the resources allocated to health. they were saying we need 6% of the GDP invested in health, and many times it is not even 3% what is invested on health. They should not hide. The government should not hide their patients under the statistics carpet. Every one of us has a name, a family name, and a history. As people living with NCDs, we need to say very much aloud, stop. Put people at first. Put people first. Put people at the center of your policies. In my country, during the pandemic, we calculate that there's been more than 500,000 casualties or deaths, out of which 130,000 were not suspect of having COVID. I mean, how many non-detected diseases are going to give as a result a death? How many people with hypertension or diabetes, or the smokers, heavy smokers? We know that we have contributed largely to increase the virus mortality rates. We know that our diagnosis is going to be serious or very serious in most of the cases if we catch the COVID. And paradoxically, now that we are more visible, we have less health services. In the INEF hospital, for example, it's a 100% COVID hospital, and we've been for more than 15 months without the possibility of going to that hospital to cure ourselves. Some of my friends have died. Some of them because of the COVID, but many of them due to the lack of drugs or medical services to treat their disease, such as Maria, for example, or Paco Roberto. We have struggled to get some drugs that now you don't find in the market, or you find at very high prices. We have been also lending each other oxygen masks, and now the laws or the acts on the tobacco law are now in the chamber, the Senate, waiting to be approved or passed, and he is frozen. Okay, now, according to data of the WHO, non-communicable diseases are a factor of the number one factor of impoverishment. The costs of this treatment, the unemployment. This is due to the fact that these are very long diseases that are generating more and more costs together with the evolution of the disease, and therefore the GDPs are going to try to solve this or to treat these diseases. So we call on governments so that they would really create a universal coverage. And once the pandemic is over, they should call on to detect people with these types of diseases, and governments should promote healthy habits, healthy styles of life. And we should have a health system that should treat all people with any disease in any place of the world without paying attention to their income level, or whether they are men or women or children or elderly. We should have seen respect for dignity and the right to health that we all have. Thank you very much. Jaime, your words are really, really encouraging, and I feel moved really by your words. Now I give the floor to Dr. Hassell, Sir Trevor Hassell, who is the president of the Healthy Caribbean Coalition, and he's going to speak about his perspective as an activist in civil society. Go ahead.
So thanks very much, Beatrice. And as I share a few comments on the ways that the pandemic has revealed the need for a more meaningful involvement of civil society and people living with NCDs in ensuring people-centered health and development plans, it is first of all worth re-emphasizing that one of the most compelling reasons for a people-centered approach to NCD prevention and control revealed by the pandemic has been the recognition that people living with NCDs are disproportionately affected. You know, as governments struggle to mount COVID-19 responses with little or no consultation with people living with NCDs, concerns of this group were often, for the most part, absent or insufficient. The national NCD commissions established pre-COVID by governments in the region to provide a multi-sectoral response and a mechanism for the voice of people living with NCDs to be heard, with few exceptions in the region, either did not function or functioned suboptimally. This all reflects that the needs of people living with NCDs are not always seen as vital for initiatives enabling access to care. Inequities in healthcare access and quality became apparent during the pandemic, exposing in particular the vulnerabilities of people living with NCDs. The fragility and weaknesses of primary healthcare-based health systems for universal health became very evident during the pandemic, often because, among others, they were in fact not rooted in the active participation of people. In the Caribbean, more than 60% of food consumed is imported. Much of it is ultra-processed and processed. One of the striking features of the pandemic, therefore, was the highlighting of food insecurity, contributing to significant challenges for people living with NCDs dependent on healthy diets. A further issue that showed the need for people-centered plans, starkly highlighted by the pandemic, has been the undue level of influence of the private sector on health and decision-making related to health. For even as the sector provided economic support, in many instances, it promoted and marketed unhealthy products and used both its power and its resources and its political leverage to oppose specific government health policies. It is evident, therefore, from these observations that there is need for a more meaningful involvement of people living with NCDs and civil society organizations in people-centered health and development plans. This approach has been outlined recently in a report by the Healthy Caribbean Coalition titled A Transformative New Agenda in NCD Prevention and Control. I'm conscious of the time, but in closing, I wanted to highlight the role of civil society in the effective communication for the prevention of the control of NCDs. Since for many years it has been recognized that communication is an important civil society tool for NCD prevention and control. In fact, effective communication has the potential to create an environment in which it is easier for policymakers to implement effective policies. It also provides an opportunity to gain high-level buy-in for policies and can often highlight challenges to health policy by specific interest groups. Effective communication strategies also permit multi-sectoral engagement and opportunities for effective collaboration with public health and non-health institutions and organizations, thus increasing the potential for positive outcomes. Both prior to the pandemic and during the pandemic, We in the Healthy Caribbean Coalition have been involved in significant communication initiatives which reflect these approaches. And for those of you who are interested, I encourage you to visit the Healthy Caribbean Coalition's website. Thank you, Beatrice.
So Trevor, muchas gracias por esas palabras, particularmente.
Thank you, Sir Trevor, for your words, and especially for mentioning the influence of the private sector, of certain members of the private sector, and how they've contributed to the weight of this problem in terms of the pandemic, but also in terms of NCDs. We're going to continue now with Stefania Palomino, who is a lawyer from Colombia, and she is the program advisor for Hudson Charitable Trust. And she's going to talk to us about innovation in this area. And then straight after, we're going to be able to look at some questions which have been written in our chat, and then we'll move on to panel number 2. I would ask you all to summarize your comments because we're a bit behind time. Please go ahead, Stephanie. Thank you, Dr. Beatriz, and thank you to everyone who is here with us today, especially those people who are getting incidence campaigns and those people that are raising their voice to give more space to those people who are living with non-communicable diseases and to tell their stories as well. And also to bring more support and help from political areas. And from Helmsley Charitable Trust, it's an honor to participate today. And I'd like to start by recognizing the work of all the people that are here with us today. And by highlighting that it's a very difficult time in history today. We're going through a very difficult time at the moment, and all those people that have shared their stories, many thanks. But what is very important is looking at this special situation that Latin America is going through at the moment. So everyone that is here or who have family or loved ones here, in the region, maybe we've lost people on a personal level, on a professional level. We've also been affected on a huge scale, not just with the COVID, but also with NCDs. So I'd like to start by recognizing this and addressing this. So by recognizing this loss and also encouraging you to think about what we do next when we get through this difficult time as a region, as a movement, what can we do? And for those who don't know what Helmsley Charitable Trust is, it's an organization in the state of New York, and we help organizations that are doing incredible work, helping people access healthcare who live with NCDs, especially diabetes, to name just one. So we're very proud to be sponsors of this work and work with NCD Alliance, and also work with partners in care, and also work with all these great people. Many of these civil organizations, I would take a long time to mention all of them, but I think the most important thing is just to recognize this incredible work they do in terms of healthcare. returning a little bit to our portfolio and what we work on, we have 3 strategies. Some of which have become more urgent because of the COVID-19 crisis. And we work with public healthcare systems so that we can try and face the financial challenges and supply problems that can come about, and work with these people so that they get high quality access to medication who live with these chronic diseases. The second base that we have in our work, or the pillar of our work, is providing insulin, a basic administration of insulin for those people who have low or medium incomes and need insulin, which is a very basic one, which is available to a huge part of the population. And the third thing that we do is help people who live with chronic NCDs, help them to raise their voices. It's a very satisfying job that we can do through NCD Alliance. And the results can be incredible, and what we can see happening on a daily basis, and so that they can share their stories on platforms and show that they are fighting and say whether they're receiving or not the treatment that is necessary. Thank you so much. I'm going to stop there because I can see we're short on time, but hopefully we can have some questions. If I can help with anything, just let me know. Many thanks, Estefania. Your words were great and also very welcome and appreciated. And we appreciate your association so much because of the help that you supply. You help us across the world, and it's a great contribution. I think we're going to talk about just one question, which I think is very important and will be very useful. So I will ask the question, and maybe a couple of people would like to answer it. The question is how to address increases in how people have been taken into hospital when we've got limited resources, and how to deal with this because of the increases in the COVID-19 situation. And we know that the poverty level has increased hugely in all of our region. I'd like to ask a couple of people and hear what they think about it. I'd like to ask Sir Trevor what he thinks is how can we increase investment in the health sector. And I'd also like to ask the Vice President Alejandra Cunha what she would think about this. So it's a big question, but if we could have a precise and short answer. So Trevor, if you could.
Yes, well, as you said, it is a very big question. I think one of the things that we might need to have might do in trying to respond is to engage in the private healthcare sector. Most of the response to COVID-19 has fallen very much on the shoulders of governments, with, in fact, very little, certainly in the Caribbean, on the part of the private healthcare sector. And I think perhaps that might be a group that could be engaged in a more significant and meaningful way to provide funding support, albeit indirectly so. I leave others to make other points. Thank you.
Excellent. Muchas gracias, Sir Trevor.
Many thanks, Sir Trevor. Dr. Acuña, how do you see this million-dollar question? Well, I think it's important that these countries, we have to do division in spending and health and look at our expenditure there. And here is where we can perfectly start to revise, to go through the percentage distribution, which we could look at NCDs, and it makes each sector, private or not, so it's very important to get everyone involved on a budget level, whether this is private or public, and then the government's role that comes through that. So rather than doing budget cuts, have a look at the legislative agreements that we've got there so that the budgets aren't cut to the public sector when they are being directed towards, for example, chronic NCDs or whatever kind of disease we're addressing, is that we don't cut this expenditure on the public sector. So here we thought about we've heard about the policy, the possibility of the help from this private sector, and also that on a legislative side that there's no budget cuts. And I think this is important to address when you're in a country, when you're looking at a fiscal reform, and this obviously affects healthcare systems and addresses the need to invest in health at certain points. Thanks so much. We're not going to take any more questions at the moment. We're just going to go straight on to panel number 2. So in this one, we're going to have a look at solutions. And we've got 4 people who are going to talk, and we are going to start with Dr. Juan Núñez, who is the coordinator of Mexico Saludable. And he is part of the NCD Alliance in Mexico. And Juan, we'd like to know about your involvement in communities in Latin America. I give the floor to you. Thank you so much, Beatriz. Welcome to everyone. Between January and August of 2020, there were 683,820 plus deaths just in that time. And it was the first cause of death. COVID replaced diabetes as the first cause of death, which obviously involved cancer and pneumonia, and also overtook all these other areas where the possible deaths could come from. The NCDs have been the pandemic of the last few years before COVID-19 came along, because the mortality rate it causes, these diseases cause. In 2020, the situation was exacerbated, and we felt ourselves facing a huge challenge as Mexico as a whole. But we were also looking not just the people that are being affected by the COVID-19, but those that suffer from NCD suffered even further. The people that were infected by SARS.2 then found it very difficult to access the necessary healthcare in terms of specialists, or whether they needed different kinds of therapy or different alternative healthcare systems. Home visiting or other services were all cut due to this crisis. Those who live with NCDs on a constant basis found themselves forced to suspend their treatments, and they were cut by the government. And also any research that was going into this was stopped. This affected the home economy of so many families. And also the unemployment in all these areas because people could no longer go to work, those with have the NCDs and those that were suffering as a family member. What happened is once this was cut, people ended up having to pay for their own medication from their own accounts, from their own money, which in some areas was no longer accessible because of lack of access to work because of the crisis. And the government and citizens, we need to take responsibility together and be able to address this emergency together. But what we have to do is that we have to make sure people know that they're being affected by this, and we have to stop letting this crisis affect people who are chronically ill. We also need to address the activities that had to stop so that contagions weren't caused to a greater level of COVID-19. And this made the situation even more unbearable, and it was very difficult to manage this situation on all levels. It is not normal for anyone to have to stay at home for more than 1 year, only being able to go out for vital reasons. And this could happen in many cases. And this also, people who are suffering from NCDs then became more likely to suffer from mental illness as well, or mental health problems. And what can happen in terms of diabetes, obesity, addiction to tobacco, all these things can affect how we reacted to COVID-19 as long as in hand with how old you are as well, which affected your reaction to these measures that were taken as well. So what I want to do is look at these questions, simple questions that we ask ourselves at Mexico Saludable, who we haven't stopped working. We've worked this from distance. We've come up with new ways. We've focused on our patients, and we've taken advantage of working from remotely to keep working and to keep collaborating with as many people as possible, and without stopping our service to those who most need it. We tried to cooperate with lots of ministers in terms of health, and being able to offer a wide coverage to people who need our help and assistance, those who live with NCDs, so that they didn't have their service, their treatment affected or interrupted by this crisis. What we want and what we need to highlight is that this treatment shouldn't have been interrupted, and we want to create an agenda to make this more possible in the future. In Mexico, what we need is a community reaction so that we make it more easy for people to access these areas and people know how to reach the treatment that is necessary for them. And in universities and in health institutions, if we have those support as well, like we have of NCD Alliance, well, we can send letters to numerous amounts of people trying to encourage this behavior and looking for solutions so that we can communicate with people and make declarations and do interviews and provide useful information to people on the social networks and communicate with the people that most matter. And this means that we can get this information to be addressed to the people that most need it. We've also organized health conferences with specialists and colleagues who have worked and who continue to work with NCDs, and we were able to start a dialogue between people who live with NCDs during the pandemic and see how they were dealing with this situation. And we published an article about the effects on these people. We know what we want to do in the coming months, and we know it's not going to be as easy as before we had this pandemic. But we know on an institutional level that we're going to have to reinvent ourselves, and that we're going to have to reinvent ourselves to live better. And this is how I'd like to finalize by saying many thanks. Thank you for your words there. Very important. You spoke about family and how this situation affected family, and that how working remotely and using technology we can also incorporate to reaching people living with NCDs. So we're going to move to our next panelist, who is Dr. Chandra Shekha Podgar. And he is the principal doctor for emerging markets at Viatris. And just to mention a few things, he's been working different markets, including Latin America, and he'd like to talk about how we can ensure this moment in the pandemic allows us to incorporate different sectors and allows us to make a significant change. So Dr. Shekha, thank you for being here and participating. Please go ahead.
Thank you, Dr. Beatrice and the NCD Alliance, first of all, for giving me this opportunity to participate in this multi-stakeholder dialogue for Latin America and Caribbean region. So there are a number of useful perspectives which have been shared so far on people-centered approaches. So I would really want to add a couple of quick points around what do we know between for the complex interplay that we see between COVID as well as non-communicable diseases, and what does it mean from a solutions perspective? What are the lessons learned to plan the solutions ahead? But before that, let me just quickly start with highlighting the twin public health emergency that we have been seeing for the last 15 months. As of yesterday, we have about 175 million cases of COVID and 3.75 million, almost 4 million deaths during this pandemic. On the other hand, the second public health emergency that we have, the non-communicable diseases, we have 41 million deaths in a year, and we have almost 77% of these deaths happen in low and middle income countries. So what we are really seeing is a syndemic with two different public health emergencies colliding with each other under the common background about this socioeconomic inequalities that we see, as well as disparities in the access to healthcare. So really, what do we know in terms of the complex interplay between the NCDs and COVID? One, we have heard before that there are significant disruptions of NCD services with COVID during the pandemic over the last 1 year. The second, which again, what we have seen getting established is the direct correlation that exists between the deaths due to non-communicable diseases and deaths due to COVID. So the model has been established, which highlights for every additional non-communicable disease death, there is almost 10% increase in the deaths per 1,000 population because of COVID. So this is a significant direct correlation that we have seen. And the third fact that we know is a disproportionate funding gap that we see in the non-communicable diseases. So till date, we have about $11 trillion of investments in this pandemic, COVID. On the other hand, what we really require is about $371 billion to conquer the SDG 3 goal that we have with non-communicable diseases till 2030. That is a Sustainable Development Goal SDG 3. If we have to address, we require about $371 billion. So it's practically 1/3 of what we require based on what we have seen till date from COVID pandemic. So what does it really mean? If we have to plan mitigation strategies to improve population health and to really protect the population from future pandemics and NCDs, we require an integrated approach. An integrated approach, and a few examples that have been highlighted. Number one is how can we leverage the twin public health emergency to re-engineer some of the solutions. For example, the COVID track and trace approaches or COVID vaccination. Can we really leverage them for driving the NCD screening using the primary care and the community health workers? So this is one approach that we really need to see. How do we pilot and implement these approaches to synergize? The second is use of technology. The number of technology solutions that we have seen during this pandemic. Can we leverage mHealth, telemedicine as an approach for delivering NCD care? So this is the other potential lesson that we can apply for improving the NCD care. And the third is, of course, really there is a lot that has been talked about public health investments. So in this pandemic, how can we leverage the public health investments for improving the investments that are required for driving the NCD care? So to conclude, I just want to highlight that we are at an unprecedented, facing unprecedented public health crisis with COVID as well as NCDs. And we have an unprecedented opportunity to leverage the crisis and converting this crisis into an opportunity. So let me pause here and hand it over back to Dr. Beatrice for subsequent proceedings. Thank you.
Mr. Shekha, a pleasure. Was very clear to tell us about the lessons learned, and very important. At the end, I want to use your words as they are very, very pointedly and very helpful. Y disculpen, cambié de idioma ahí en el medio. Pero ahora quiero presentar.
Now, I would like to present Diana Gettins. She is a member of the committee, Our Views, Our Voice.
And she works for the telecommunications private company, telecommunications or telecommunications company, and she works on cancer in Guyana. And we would like to hear understanding from different sectors and the best practice to involve people that are affected by the NCDs. You have the floor, Diana. It is a pleasure to greet you.
Thank you so much, Dr. Beatrice. And thank you for the opportunity. So how can we have greater involvement of people living with NCDs to achieve improved health system outcomes? And the response can be simple, but actually implementation might be definitely a little bit more challenging. It can be as simple as we, a community of persons, and taking an approach that focuses on we. And when I say we, I don't only mean us, but I also mean we, an acronym that I developed: willingness, education, and creating an enabling environment. And when I speak of willingness, I'm referring to willingness to accept that persons living with NCDs are experts. And as Jamie mentioned much earlier in this session, it's like building a bicycle and not taking into consideration, not realizing that the persons who actually have to ride the bicycle, that they're experts. And unless stakeholders, and I mean program managers, health ministers, private sectors, unless they acknowledge and they're willing to acknowledge actually and accept that us, the persons living with NCDs, are the experts, because we go through the entire system. We interact with the system from the beginning to, I would like to say, the end, but we go through the entire process, we experience everything, and so we know what it is that we're looking for, we know what our expectations are, and we know how we're familiar with how the healthcare system impacts us. The other thing I'd like to talk about from the we is education, ensuring that persons understand, all key stakeholders understand what meaningful engagement means. Understand education in relation to what the barriers are, what the challenges are, what our success stories are, and what the roles are. So if we, and I think that having the global charter right now on meaningful involvement, and whenever it's launched, I am sure that this will be an excellent tool in educating the various stakeholders on barriers, challenges, successes, and the roles that they play. Because even though we're experts, many times we may not understand our role, and because we haven't been doing this for so long, even our stakeholders that we are asking, let us play a role, they don't understand, or they don't know the role. They don't understand what their expectations can be, or what we can do and what we can contribute. So I think that education on what meaningful engagement is, understanding the barriers and the challenges, would definitely assist. The other E in the we is creating an enabling environment. So we know that we're experts, we know that we need to be educated on what meaningful involvement is, but we also need support as persons living with NCDs to develop additional skills. So we know that I share a personal experience when I'm a cancer survivor, and when I started this journey and I decided that I wanted to support and I wanted to ensure that no one else would be impacted the way my life has been impacted, I did not feel that I had the skills needed. And I can tell you, working with the Healthy Caribbean Coalition, working with the Our Views, Our Voices initiative has provided me with the confidence and the tools. This is how you share your story so that you can have an impact. And even trusting and believing that I can do it and believing that I can, that helped me. And that enabling environment prepared me for the role that the several roles that I've played in advocacy. And I don't want to only end here, but I also want to say, in my current capacity as the advocate for a private organization, I was selected to represent the company in relation to all our cancer awareness activities. And the only way that this could have happened is because the company, the CEO decided that, I'm an expert in my area, and that we need many other stakeholders to take it. So that's willingness to accept. We also know that I would have pursued and I would have been supported by various organizations, the HCC, the OVOV, understanding my role as education, and just having an enabling environment has given me the opportunity to share with you here today. And so when I ask myself the question, how do we and what strategies do we use to have greater involvement? It's willingness to accept, it's education, and it's creating an enabling environment. Thank you so much. Beatrice? Beatrice, did I go too quickly for you? No. I was very aware of the
time. We are just very pleased because we want to have additional time for questions, but very pleased about your comments, particularly your combination of the need for education, building awareness, and on the other hand, also creating an enabling environment. Again, I'm changing languages. O sea que me pareció muy importante la combinación.
I deemed very interesting the combination between education, conscience, awareness raising, and the significant or the meaningful involvement of people affected by NCDs, and the creation of this enabling environment. This is very interesting. Thank you very much, Diana. And now we are going to give the floor to the next speaker, Diana Baca Magee, your namesake. I know Diana for a long, long time, and she's the director of global advocacy of the American Heart Association, but she has an experience of 15 years working with NGOs, and she has been also working with multilateral and bilateral organizations, and she's going to speak about or give us an idea on how multilateral governments and the relevant private sector can implement a focus on approach that would be more focused on people. You have the floor. Thank you very much, Beatriz. Thanks to everybody. I'm going to present in English so as to shorten the translation that I have to do with my script. But above all, American Heart Association
to be a relentless force for a world of healthier, longer lives. And part of the role that we've been playing, both in the US and globally, has really been about trying to build these bridges that help to accelerate evidence-based practices and programs that include public policies that address cardiovascular disease and stroke. But I think something that we've noticed over the course of our time is that we need to be very holistic about what we mean about good health and well-being. And this really stresses our need to start looking at social determinants of health. We recognize that our work has to be done with others, and so much of it has to be about building coalitions and working with diverse sectors, including governments and the multilaterals and the private sectors, and really trying to find common ground around addressing our concerns with them. And part of what I'd like to do just in terms of our intervention today is to speak to you a bit about the health equity and how AHA is sort of perceiving, the American Heart Association is looking at the issue of health equity in terms of believing that first, every person deserves the opportunity for a full and healthy life. And while I'm speaking to you from the United States, from the capital of Washington, D.C., where in fact health is not enshrined in the American Constitution as a right, we know that the role that non-governmental organizations like ourselves as part of civil society is that we champion health equity, and we really look, and we've been in the business for very many years about identifying and really removing those barriers to healthcare access and quality. One of the ways, and I want to submit that one of the solutions is for organizations like ours. I think we heard from the Helmsley Charitable Trust earlier, but really looking at how do civil society organizations begin to build programs where they can invest in social entrepreneurs that are building really these key solutions. For the American Heart Association, one way where we've tried to do this is through our Accelerator program and our Social Impact Fund, which really are both two very distinctly programs to build business acumen and skills to build the capacity in organizations that really are embedded in the community. So far, we've funded about 45 entrepreneurs in one of the programs, and we've already invested over $5 million across the country in different cities, key programs that are really helping to address these issues. Why are we investing in entrepreneurs? We know that business solutions are needed to respond to local communities and to affect really meaningful change in the lives of people living with NCDs. We have to go really much deeper than their condition of cardiovascular disease, but perhaps issues like education and housing and the environment that is impacting their access to fresh fruits and vegetables, for instance. So we know that organizations and individuals who have lived experience have those deep community connections. And so I would submit that programs must start with the inception of engaging those individuals with lived experiences to provide really that community insight. For one of these programs, we really have the opportunity also for the community to vote on the most promising idea for this monetary reward that we put a request for proposal on. Each of the entries are really looking at social factors that impact a community's ability to achieve health equity and well-being as a key obviously requirement for this funding. Some examples just include a diabetes management wearable device that was supported, and the other was an organization called the Link Market, which really addresses food insecurity and transportation barriers by providing affordable groceries at metro stations, for instance. The fund is really intended to be nimble and reactive, and it's really designed to work in cities and rural areas alike. I would say that it really meets entrepreneurs and communities where they are, and it really takes a bottom approach to funding solutions. And the fund has been so nimble that, in fact, with COVID-19, we've had an opportunity for us to redirect fundings to really address some of the striking issues that we've all discussed in this consultation so far. So I would say, what's the return on investment around health equity? I think we need to begin to look at how funding efforts from civil society and pushing for these new kind of business models really drive building wealth for others, really having individuals, have and earn an equitable income, having access to really capital markets, and really support one another in terms of building really those community-based solutions. So I want to stop there in light of the time, but thank you, Beatrice, and thank you, NCD Alliance and others for this opportunity to share.
Excelente, Diana. Muchas gracias.
Excellent, Diana. Thank you very much. It is very important to have this connection with the health determinants. You mentioned training, education, environment, and what is habitational, I mean, the ability to have, or the fact of having a place to live which enjoys of better nutrition, for example. This is very good. Thank you very much, Diana. We're going to move on to a couple of questions, and then we will finish with a series of final conclusions. I have a question through the chat to Estefania Palomino. And the question is, what examples of strategies of significant involvement are the most efficient for type 1 diabetes patients? And what are the actions within the Helmsley program, or what actions Helmsley is considering for the access towards quality treatment? Maybe you can inform us a little better on the programs and what you consider more effective in terms of type 1 diabetes. Yes, of course, it's a pleasure, Beatrice. What we consider more efficient is to amplify, to give a stronger voice to the people coming with type 1 diabetes due to the low prevalence of this disease. A few years ago, not so many international or global voices or WHO voices were known of people that live with this disease. And the fact that they are now telling their stories, this is very important. This is one measure. And the second one would be to support advocacy programs that should focus on obtaining the essential drugs that are required to manage diabetes, type 1 diabetes, even in scenarios of low income and high vulnerability. Nobody should die because of type 1 diabetes, regardless of their socioeconomic situation and their geographic location. This is what Helmsley considers and Helmsley's vision. And we therefore need programs that are focusing on this, so that everybody has an access to insulin and the essential basic needs or supplies for these patients. Thank you very much, Estefania. Thank you very much. I have one question for Deputy Cuevas, or the Member of Parliament Cuevas. The question is how to foster universal coverage 2030. No, sorry. Oh, Gabriela Cuevas is not in the meeting anymore. I'm so sorry. So we cannot ask this question, but maybe some other person can answer. So I continue with the question. How can we look for synergies with universal health coverage 2030? What are the synergies that might be created, and how to incorporate to the health systems the priorities of the different sectors? We're talking about international sectors, that is governments, political parties, and the society at large. It hasn't been any easy to involve all these sectors, and therefore I would like to ask all of you panelists, how do you see this possibility of supporting universal coverage, health coverage, I mean? Forget about the 2030, I think that was a mistake. I think, Beatriz, that the civil society organizations play a very important role, because they involve the different groups to start a dialogue. And this helps advancing and identifying the needs of every sector, because obviously sometimes it is a bit difficult to advocate for different topics and they are not seated at the same table. And therefore, to create that table so as to have the participation of every sector is really good. And there are many organizations that are represented here today that have that integrity to be able to call upon, to gather, to bring together all these different parties and stakeholders. And that's very important. Thank you very much, Diana. I would like to hear what people have with a lived experience like Jaime or Bruno. How do you see how this priority should be given to different sectors? Because sometimes they don't see the importance of universal health coverage, or they see it as something very costly and very pricey, and is something impossible to do. If we want to change and transform our societies, how should we do this, Jaime? Well, in my perception, I feel that universal health coverage, based mainly on diagnosis and early detection and early care, will be able to make these diseases be less costly. Policies to restrict industry are going to make our society a healthier one. Prevention, focused as or considered as a global good, and the universal health coverage based on healthy habits and prevention will remove a lot of stress from the system. So it will be easier to contain a disease at the earlier stages than to give palliative treatment or care. So prevention and the universal health coverage based on prevention is much cheaper on the longer run for the state.
If I can add on that, Beatrice, I would highlight 3 points. The first one, I believe it's important to change conversation from universal health coverage to universal health care. We need to keep in mind that it's not just a matter of providing coverage to essential medication and to essential supplies, but also, as Jaime said, about health promotion, about prevention, and about guaranteeing those living with NCDs and the future generations, they will be able to access health programs, health systems on which their health is the priority and not the profit. The second point, of course, okay, we can sound idealistic about saying this like universal health systems, but how can we practically move to that? So we know that we need to increase the amount of money of Ministry of Health, and the best way of doing that is increasing taxes of those products that majorly cause most of these NCDs. So I see there's no way other way instead of like increasing the taxes of unhealthy products such as sugary drinks, the tobacco, and ultra-processed food. And third, but not least, we need to guarantee that people living with NCDs and with lived experience are part of this conversation. And we need to also change the approach, because usually when we talk about universal health care or universal health coverage, as you wish, we tend to use the human rights approach, and in my opinion, should be the priority. But unfortunately, we know that decision makers, especially policy takers, they don't see the human rights approach as a priority. So we need to switch conversation and show the impact, the economical impact that NCDs and not providing universal health care have for their economical system. So I think that's it, Beatrice.
Muchas gracias, tanto a Bruno como a Jaime.
Thank you very much, Bruno and Jaime, because you really gave a very important answer or response to how to use the universal health coverage and how to look for synergies. Okay, well, we are close to finishing this event, so close to the end of this event. I know that there are many questions that we will have to answer during this process in which we are involved, so as to develop a global charter that will enable us to clarify what we're talking about when we talk about significant or meaningful participation of people with NCDs or patients of NCDs. I would like to underline some of the things that were mentioned that I considered more significant. Everything was very significant and very important, but maybe I will underline the most important. I deemed very interesting the mention of Jaime or by Jaime and other people that universal health coverage is really a way to invest better in the health of people, and that costs should not have to be very high. They are high now because of the way we are working now this moment with this disintegrated health with crisis that we don't see an appropriate way to solve sometimes. But there is also disinvestment, and this disinvestment takes place through corruption, as the Member of Parliament Cuevas mentioned, and also Sir Trevor mentioned, through the conflicts of interest. This type of disinvestment does not help us advance or progress the best treatment and prevention of non-communicable diseases. Also, the accountability mechanisms were mentioned, and this is where we need the citizenship and the population, because they should reinforce the need for monitoring and accountability. I really liked as well that Bruno mentioned his optimism related to what the changes that are taking place, and this was also mentioned by Dr. Shekha, Chandra Podgar, who who spoke about changing a crisis into an opportunity, or transform a crisis into an opportunity. And he was very positive and optimistic when he mentioned this. He spoke about an integral through mechanism, and he spoke about how to use the actions that are being taken related to the COVID to mechanisms as to determine who is suffering from hypertension or diabetes. So these two efforts can be joined together. And some people in the group spoke about technology. Well, it is true. The world has changed due to the pandemic, and we have all learned that technology is essential, both when taking care of patients and health care, but also in prevention. We have changed totally our way to work, and this was mentioned also by Juan Núñez. He was saying that despite all odds and despite all the difficulties that we've had, the task has continued thanks to technology. Investment in public health has a big return on investment. Diana mentioned this with the task that they are carrying out, the works that they are carrying out at the American Heart Association. Dr. Hennings mentioned the transformation crisis, opportunity. This is the same. And the structural barriers that we're facing. Despite optimism, there are important structural barriers, and not everybody recognizes the priority that should be given to NCDs. I am constantly reading articles in the public environment or scope, and I don't see public sector, and I don't see sufficient attention paid to NCDs. The news that I read, my newspaper or on the TV, I see that there is an enormous need to communicate why this pandemic has been so terrible. And it has been so terrible because it overlaps an even bigger pandemic, despite the fact that it is a silent one or more silent one and a longer term and a slower one, but with a much higher importance and magnitude, which is the NCD pandemic. I was also very interested by listening to the Vice President of the Costa Rican Ministry of Health, Doctora Acuña, because she mentioned how health ministries looks for, and many health ministries do this, look for listening to the affected people, the civil society participation, and the people, of course, suffering from these diseases. I really loved the analogy with the bicycle. This is an analogy that well, I suppose most of you know how to ride a bicycle, and you perfectly know how is it to try to ride a bicycle that is either too big or too large or too small, or not adjusted to your needs and to your morphology, let's say. And this is a very good analogy so as to explain why are we talking about the need of this active participation of the communities and the people affected by these diseases. In my opinion, it was a very significant and enriching set of presentations and opinions, also coming from the dialogue with the participants. I would like to thank you all, very especially. I would like to thank the Helmsley Trust, Charitable Trust, that has supported this event and all the regional events. I have a lot of hope for this global charter that we want to take in September to the Global Action Week. Well, thank you very much to everybody, and I highly appreciate the participation of the speakers and the participants.